Welcome back to another episode from the Optimal Body Podcast. I'm Doc Jen.
And I'm Dr. Dom.
And today we're going to be talking about calf strains. Why do they happen so often? What can you do about them? We're going to break down all the nuances for you. Now, before we get into all the different types of strains that can happen when you strain your calf, we just want to remind you to please subscribe to YouTube if you haven't yet, because we have so many more podcasts just like this and other ones where I just guide you through movement. So whether it is a flow or a specific exercise that's going to help with the pain, we have a ton here for you on DocJenFit. So please subscribe and then leave any comments if you've experienced this. If you have more questions, we're happy to dive in deeper on other topics with you as well.
So we're diving in today for a pearl on calf strains. And calf strains and Achilles ruptures, I kind of like to refer to them as the has-beens injury, because a lot of people who used to be, major athletes or in sports, or especially in sprint sports like basketball, baseball, anything that you are doing a lot of fast starting and stopping, explosive movements, your body and your mind still remembers how you used to do it.
Yes.
How it used to have been for the has-beens. And then when you're into your, later 20s or 30s and you go back out for a game of pickup basketball after not having played for 4 or 5 years, that's when it might happen, because again, your brain, your body is used to what it, used to be able to do and remembers that. And so you try to do that, and the calves don't have that ability in them anymore. They don't have that strength. They don't have that ability to handle that tensile force or that rapid change in direction.
We have these kinds of injuries because it crosses the knee, typically when the leg is extended all the way, and then we get a fast, ballistic change between ankle dorsiflexion, so toes towards you, and then plantar flexion, toes away from you. So think of pushing off, right? And so if we push off with an extended knee in a really rapid pattern that your body can't tolerate that amount of load that quickly, that's where we typically start to see that strain.
We actually have fibers within our tendons that sense how fast our muscle changes length. And it's actually a protective mechanism to prevent us from straining or tearing a muscle, which sometimes actually results in us straining or tearing it anyway. When we stretch at a rate that our body isn't used to, or those little muscle spindles that are in our tendons isn't used to, then that muscle wants to contract. And that's where that contract will maybe perpetuate straining some of the fibers itself.
And we might get this feeling of being struck in the back of the leg, or you might even hear an audible snap or pop that comes with it. And then a lot of people kind of report this dual type of pain that kind of lingers.
You see this more so that the highest density of population that get these injuries are men in their mid to late 20s. Like I said, has-beens, so probably played a sport in high school and college, and then they're getting out trying to relive the glory days, and look at that, you strain your calf. But yeah, in activities that you're doing a lot more acceleration, deceleration, you see a significant amount more in men, especially in athletic or active male populations versus a female population.
You might be at a little bit more risk if you do have hypermobility that runs generally within your body. But also we have to pay attention to our fatigue as we're getting into activity. Are we super fatigued as we're going through something? And our failure to lengthen a muscle, that is a risk factor as well, which is our general mobility.
Yeah, and that's where we'll talk about the type of footwear that you might have on. If you always have a heel lift and then you suddenly try to go out and do something barefoot, you're going to be putting a lot more strain on that calf because you don't have that lift anymore. You're going to need to use your ankle more.
So we're going to talk through the different stages of these strains now. Know that, obviously we're not diagnosing or telling you where you are in your stage, but it's just something to understand, okay, how much can I get back to activity? And we're going to talk about some of those activities and treatments that you can do as we go on as well. First of all, we have that mild strain. And so this is going to be more of that sharp pain that you feel directly when you had the injury or when you had that activity, but you can still kind of work out. You just might have a little bit more achiness or pain, especially at the end of your activity. So you can still move with it. And we can see a return to activity in as early as 10 to 12 days.
And this moderate strain, it says you're disrupting between 10 and 50% of the fibers.
Which is a big range.
Which is a huge range.
Yeah.
If you're disrupting 50% of the fibers, it's going to be a lot different than if you're in the 10 to 20% range. You'll probably see some mild swelling and bruising, because anytime we disrupt a lot of tissue, there's going to be some bleeding there. And if it is closer to the 50% range, you might be able to actually feel some sort of deficiency in the muscle somewhere. Something happened there. And the return to activity timeline in this says between 16 and 21 days. Again, that's going to be a big range, especially if you're more in that 50% range of the muscle fibers being disrupted. It could be quite a bit longer.
And then we get into like that severe strain where this goes all the way up to 100% of the fiber disruption. So this is full rupture to a lot more rupture. And this is where we're definitely feeling, right? With the palpable means that we can actually feel the disruption within the fibers. And then we really we're unable to walk. We're unable to continue any kind of the activity that we were doing. We do get significant bruising. We are getting significant swelling. And then our return to sport or activity is probably 6 months or greater. Also, a risk factor for your gastric strain or making it worse is not rehabbing yourself properly and giving yourself enough time to get better before you go back to your activity. And so now let's talk about treatment. What are we doing to try to get a little bit more motion, a little bit more movement, and make sure nothing locks up? And especially when we get a sudden strain, it could be really scary, right? And so the last thing you want to do is exasperate it or make it any worse. So, we're usually afraid to move, we're afraid to stretch. And this is where, research is showing it's good to go into these ranges of motion. Just do what is tolerable for you. Make sure you're not pushing into pain.
So starting to get yourself into some passive dorsiflexion, even if it's taking a towel or a belt or strap or something to lightly pull that foot back towards that shin. It might feel uneasy, but it's something that we should definitely do. And just an easy thing that hopefully every PT is trying to tell you is like just sitting there and spelling the ABCs with your feet. That is more active range of motion, but spelling the ABCs, both lowercase and capital, it doesn't really matter, but like both of those are going to get you moving that ankle in all directions actively, again, to start showing the muscle fibers, okay, we can do a little movement. You're kind of utilizing the inflammatory process to then like teach all of the building materials that are coming to that area. Okay, here's how we need to rebuild. Here's how we need to heal these fibers, rather than sitting still for any amount of time, really.
So starting to get low load static stretching is a really good way just to maintain not only that range of motion, but we also see that static stretching and static holds can also help to, kind of prevent that muscle atrophy. So keeping that muscle from wasting away, especially in those early stages. You can tolerate as a stretch. It doesn't have to mean that you're on a slant board and you're going into a full stretch, right? But even if you could take that foot, bend the knee, and start to get some range of motion in it, wherever you can stretch to, that is your low load.
Yeah, that's like I was mentioning with the towel or the strap, or even like for the soleus with knee bent, just resting with your feet flat on the ground and scooting forward to the edge of the chair and tucking those heels underneath you a little bit more and trying to get those heels to the ground. That's low load, and just sitting in that static stretch can be really helpful. And then after that, you really want to start doing some active stuff. And so before we start putting pressure into the calf itself by doing plantar flexion, working the muscles on the front of the shin to get into active dorsiflexion. Like I mentioned, doing the ABCs is going to start to do that. But what we call isotonic exercises, or if you have an exercise band, you can kind of step on it with one foot and then use the other foot to do kind of toe raises, where you're going to be working the muscles on the front of that shin to come into dorsiflexion.
And you can also work the muscles on the side of the calf as well. So our peroneals, where it's not necessarily into our calf, but it's more on the side. So that's, using that TheraBand again and maybe kicking the foot up into the side or up and out, getting just different ranges of motion as tolerable. Again, maybe that's not even with the band yet. Maybe it is just spelling the ABCs, but it's using as full range of motion as you can and in a really controlled manner. That's going to help to start to work back into, okay, now I can start to work my calf. Now I can start to maybe even put some isometric meaning not moving, some tension into that calf and just starting to hold.
Yeah, and that's even where, with the band, a pretty low bar is then starting to do plantar flexion against a light resistance band, because it just starts to give you some of that feedback of, okay, here's what it feels with my calf to press against a little bit of weight before we start doing any sort of weight bearing. Especially if weight bearing is tough and you have had a little bit more of a severe calf strain, starting with just a band or something before you get into doing any sort of balance or standing. A lot of what we saw said working with shoes that have minimal or no heel lift, or just working barefoot, can be really beneficial, because again, like if you're consistently consistently wearing something with a heel on it, even if it's a half inch or a quarter inch or an inch, that is an inch or a half an inch less that our Achilles tendon essentially, or our calf, has to stretch for our heel to get to the ground. So just standing barefoot and shifting weight side to side can be really beneficial. Standing and starting to shift into our toes and shift back to our heel, that's going to help us get more of that isometric proprioceptive feedback by just standing and starting to shift our weight into that leg.
Yeah, and starting balance training as soon as possible,
Yeah, and a great kind of progression to think about with heel raises, because that's one of the things that we'll go to when we start strengthening, is if you do start in sitting, you can always put a little bit of resistance on your knees if you've got dumbbells or something, or just sit to the edge of your chair and lean into your feet and kind of put some of your body weight and then do heel raises with the knee bent. I also like to do heel raises where we have our toes pointing forward, we have our toes pointing inward, and we have our toes pointing outward. So then we're kind of hitting slightly different fibers that we're putting the main stress on. And then if you go into standing, starting on flat ground, doing heel raises, again, toes forward, toes pointing inward, toes pointing outward, maybe then putting something small under your toes. Because again, then we're getting ourselves into the kind of that terminal stretch of the gastrocnemius when we're in standing, and doing same thing, heel raises, toes forward, inward, outward. Single leg, because then again, we're really just loading on that one side, and that's what's going to be similar to jumping off one leg, or suddenly stopping and changing direction with the majority of our body weight going into one leg. And then you can even do single leg with resistance.
And I think one of the most important factors to remember as we're starting any kind of strengthening program, or even in prevention, right? We always want to be thinking of that eccentric phase, that lowering phase, because that's where we're getting a lot of strength into that muscle, but we're also getting a lot of mobility and flexibility into that muscle at the same time. So that means if we're thinking about a calf raise, we're not just thinking about the lift. That's not the most important part, but the really slow lower, especially on a single leg.
And then that's where we progress into different plyometrics, where we're doing jumping and landing. And again, that eccentric is going to help us with those landing phases where we're quickly stretching into that eccentric stretch, but it's going a lot faster. So that's where we're doing it controlled and then working into the explosive stuff. As far as prevention goes, one of the best things you can do is warm up. Warm those calves up. Put some load into them. Every time before I have a game now, I'll stand on the sideline and just do some controlled type plyometric exercises, get against a wall and do some like fake runs where I just like quick change from leg to leg. It's going to get those calves prepped so that you're ready when you start to get back into that activity.
So especially in like high intensity workouts, running, anything that we're going to be changing quickly with our feet, we have to be warming up. And we can put load and stretch into it at the same time as starting to put a little bit of dynamic work. That's just going to help for what you're doing in the activity.
Thanks for tuning in for another episode from the Optimal Body Podcast, all on those calf strains. Have you ever experienced a calf strain? Comment below. Let us know if you learned anything, if there's any questions that you still have. Remember to hit that subscribe and notification bell so that you can get all of the different topics that we come out with in the future. And of course, we'll see you next time.